For Thailand, I don't know if Dr. Bunchai is in the call. I heard his voice, but I do not see his name in the attendees. They plan to get to understand more about OpenIMIS. This is actually the Ministry of Health, and then to understand how to map their existing current needs with existing OpenIMIS functionality. The focal point is Dr. Bunchai Kitchenayotin, and the hub will be his office, the Thai Health Information Standards Development Center. And if you're interested in knowing more about what he's going to do, you can send an email to kijs0001@gmail.com. For Indonesia, we'd like to call on Anis. Maybe briefly, Anis, you can tell us more about how you plan to use OpenIMIS in your Indonesian community of practice.
Hello, Dr. Alvin. Sorry, I think Dr. Anis got disconnected.
Ah, we got
Oh, there.
disconnected, but in our yes, thank you. In our last discussion, Anis was planning to engage the Masters of Public Health program in the University of Gadjah Mada and to allow them to look for opportunities for using Open IMIS in public health education. They actually have a master's program in health insurance, so he's very much interested in finding out using Open IMIS again to concretize some difficult concepts in health insurance management and to also show how ICT can improve management of a national health insurance system using OpenIMIS. If you're interested in knowing more about that, please contact anis.fuad@gmail.com. So with those three countries, I would like to know from this call, if you're interested, we're looking for focal points specifically for Cambodia, Laos, Myanmar, and Vietnam, but other countries are welcome as well. And if you are, please send an email to secretariat@ahin.net. And we've reached the point where we can now entertain your questions in the open forum. So maybe, Charisse, can you help me with the questions?
Yes, Dr. Alvin. So, we have our first question from Dr. Carl Stroman. It's about ID safety. So he's asking, do pictures really help? For example, all credit card companies ineffective, and what is the experience with ID theft?
Okay, so are there two questions there? The first question is ID safety. That's why, Carl, we are not in the Philippines. We are using it in a laboratory setting, not in a real world setting. But maybe I can ask Saurabh, can you field that question because you're now actually implementing that system in Nepal?
Yeah.
Saurabh?
We haven't had a lot of issues of, we haven't heard of any particular issues of ID theft, but one of the main learnings from insurance schemes before was around people not bringing cards, and you couldn't verify if a certain person was who they claimed, and they couldn't check their validity as well, if their insurance was still active. So the ID cards are really helpful in that, and even pictures for some people, because if just a name, the ID card that we use does not have information such as age, because that would change. They do have date of birth, but it's quite complicated. When everyone's in a rush, it's difficult to calculate age. If they can see a picture and just look at the person, then it's much more easier to verify. But before, we've had particularly not theft as in such, but in smaller community-based schemes, using of the same card between non-immediate family members. So the same scheme would be the same policy would be used by people beyond the family as well, not as in theft, but just sharing of cards. So this has been a good way to prevent that to a certain extent as
Okay, thank you.
Thank you, Dr.
Charis?
There's also another question, Dr. It's also from Dr. Carl. So his second question is, do injuries also always go to the same doctor, or do they do doctor hopping?
Okay, so me first, Saurabh. In the Philippines, they do doctor hopping. So for sure, the patients and the policy in the Philippines right now allow the patients to choose their doctors. But I know for a fact that our Philippine Health Insurance Corporation, or PhilHealth, is trying to create a system where there would be a designated gateway physician where they must go first, and then from this physician they could then be referred to other physicians. This is very challenging and always a problem, especially in developing countries when systems are not in place. But in fact, when this happens, then that's where the portability of the patient record becomes very, very important. Saurabh, how about you?
In Nepal, we foresaw that a lot of people would just hop between health facilities more than doctors. And one of the function requirements and defined by policy in Nepal is when someone enrolls, they have to select something called the first service point. So they have to go to their the closest primary care facility, and they have to select it during enrollment. And if they go there and then get referred through the health system, then the insurance pays for it. But if they jump to another facility, let's say a higher level facility, without going to their primary care provider in cases beyond emergencies that are not emergencies, then
Yes.
the health insurance wouldn't cover it. Right. So these are, and that can be defined in OpenIMIS what your first service point is.
Yes, that's the same policy that the Philippine Health Insurance Corporation is also formulating. I think that's a good balance between um, having some system in terms of making sure that you're optimizing the services of your primary care provider, which is your first health facility, but at the same time allowing that flexibility to also be able to see other doctors for as long as the primary healthcare facility is aware that that is actually a better quality service for the patient. Charis?
All right. Our next question is from Dr. Pradeep. He's asking, does the current version of OpenIMIS facilitate user interfaces for biometric-based patient authentication, for example, for patient enrollment and claims submission processes? And if not, is it a future consideration?
Saurabh, I think that's for you.
Yep. So currently, there is no biometric authentication, and what the OpenIMIS initiative is trying to do is not only focus on as in the roadmap on authentication, but we're looking into modularizing the system as a whole. And if you follow through on the wiki, and we'll have more information on this as time progresses. We already have a company working on modularization. Then we'll have open APIs where different technologies for biometric authentication can link in. So I speak for Nepal. In Nepal, there will be some issues if we bring, let's say, fingerprint authentication because of cultural issues and some past practices. It would be a problem. But some somewhere else, it might be the solution that is required. So OpenIMIS will be designed. The next versions will be designed in a way that it's modular enough that if someone requires biometric authentication, a module can be built for OpenIMIS for it.
Okay, Charis, we're running out of time, so maybe uh, one last question.
All right.
So I see what technologies have been used to build the tool. Uh, Saurabh, this is MySQL. Correct me if
Yeah,
I'm wrong.
no, right now it's Microsoft SQL.
Yeah.
Right now it's Microsoft SQL and ASP.NET. It, but the software has been licensed as AGPL. for open source. It can run on the um, free edition, the Express edition of SQL Server. But again, the redesign, the re-architecture will make sure that the entire stack used is also open source. And if I just
Okay.
take the question right following it, the timeline, please follow on the wiki. Will have an updated timeline in terms of when we expect the next versions and what the features will be. Generally, we're looking at 2 to 3 releases per year.
Okay, so thank you very much. We've reached the exceeded our 1 hour. If you are interested in participating in your country community of practice or in the regional community of practice, please send an email to secretariat@ahin.net. Thank you, Saurabh, for our demo and walkthrough and for the information. We'll be having this on a monthly basis, but we'll also be conducting weekly meetings with some of the countries and finding out what innovations they have thought about in terms of promoting concepts of UHC, open source software, and information management information systems. This is Dr. Alvin Marcelo. Thank you very much, everyone. For those who are in the call who have not been able to communicate, I'll be available by email and let's talk about things that we can do together. Thank you. Good night.
Thank you,
Thank you,
everyone.
everyone.
Good night.
Thank you,
Bye.
Saurabh. Are you in Kathmandu?
Yes.
All right. Take care.
All right.
Good night,
Bye bye.
everyone.